Thank you so much for being with me today. Today is part 3 of the 5-part series, and we're going to talk about pancreatic deficiency. Pancreatic elastase is an enzyme that helps break down foods, and you think, what in the heck is pancreatic deficiency? What are some symptoms? Fatigue, diarrhea, your stools float. But this enzyme, elastase, pancreatic elastase, it breaks down starch or maltose. And there's a good way to test this. It's actually in this stool. We do pancreatic elastase in this stool. A normal number is greater than 350 micrograms per gram. And there's varying levels of that, but severe pancreatic insufficiency is less than 100. And that's determined. You have to use a broad range of pancreatic enzymes. What's commonly known, the disease state that's commonly known of pancreatic insufficiency or deficiency, actually is cystic fibrosis. And I used to work at Children's in Columbus, Ohio, and took care of a lot of these little babies. They actually have really fatty, foul-smelling stools, and they do a sweat test to determine if they have cystic fibrosis, but a lot of it is symptom-wise. So, adults can have a lot of fat in their stool. You can have a lot of problems with that also. But this enzyme, pancreatic elastase, is specifically, exclusively excreted by the pancreas. And it's actually, this pancreatic elastase is a little more accurate now than chymotrypsin, as the result of this deficiency is not does not correlate with taking digestive enzymes. So you can take pancreatic enzymes and it will not affect the result. So, but it's a pancreatic elastase is the gold standard now that's used to determine this. So one of the other things that traditional medicine can do, they can do a 72-hour fecal fat test. And so what they do is they give you 100 grams of fat to eat, and whatever is not absorbed comes out in your stool. And the normal range is less than 7 grams of a fat in your stool is what should be. If you have more than that, then you're not absorbing it. But cystic fibrosis is the main cause, and you can have a lot of pancreatic insufficiency these days too. So if you have a lot of fat in your stool floats, it's light colored, that can also be a symptom. And so the second part of this topic, I'm going to talk about biliary insufficiency or bile acids. And there's primary bile acids, and this comes from fecal bacteria and probiotics, and that's converted into secondary bile acids, which are these terms called DCA and LCA. But the dietary fiber and the fecal bacteria determine the rate of how this is broken down. LCA is the more toxic secondary bile acid, and it's many times correlates with people that have colorectal cancer, breast cancer, gallstones, and then after gallbladder removal, it's usually higher. And this primary bile acid is synthesized by the liver. The secondary one is the conversion from primary to secondary. People can actually have bile acid reflux. One of the things that most people are not told when they have their gallbladder out is that they potentially can have dumping syndrome. 30% of the people with their gallbladder out have dumping syndrome, because you have to remember the gallbladder is the storage area for the bile, and now that's gone. That bile is just released into the GI tract. And some people, as soon as they eat, they have to wait an hour because they know they're going to have loose stools or diarrhea, and they can't go out anywhere until that happens. So bile acid malabsorption happens with irritable bowel syndrome, specifically with diarrhea. And it can occur with or without an intact gallbladder. The bile acid absorption may affect up to 30 to 50% of patients with chronic diarrhea. It can be treated with bile acid binding agents like cholestyramine, which is used for cholesterol binding and mold binding also. There's a blood test called C4, a C4 scan, and but that's not really available that much today except for in like Mayo Clinic that determines this problem. Recent studies now suggest that bile acid can bind to starch and prevent its digestion. So you have a lot of people that have symptoms. It's because the bile acid binds to the starch and inhibits the, for you to clear that. Probiotics help convert primary to secondary bile acids, and that's the bacterial action in the colon. This was part 3 of a 5-part series, and I would love to help you on your journey to good health, but look for some more information, and I'd be glad to help you. Thanks a lot. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.